Day one, live from Algiers on day one of the Intra-African Trade Fair 2025. That is taking place, as I said, at the in Algeria at the Abdelatif Rahal International Conference Centers. As we see here, halls are buzzing, and there is a large focus on investments, trade, exchanges among African nations, and healthcare security. And if we focus, today we're focusing on the latter, and with me a leader who lives that challenge every single day across the continent, Mr. Maturin Tchoumi. Maturin Tchoumi has over 30 years in healthcare across continents and now leads Russia's pharmaceutical business for Africa. Great to have you with us in the studio, sir.
Thank you, Islam. Thank you for having me. It's a pleasure to be here with you this evening.
Pleasure is reciprocated, sir. So as a warm-up question before we dive into the discussion, how do you describe the vibe on the ground for Roche in the Intra-African Trade Fair that is happening here in Algeria?
I would like to start by saying it's a privilege to me to be here today and witness what is being projected, right? To think about Africa, where things is happening within Africa. I could feel this morning in the main auditorium when the presidents were talking about what Africa can look like if we start trading amongst ourselves. I do believe, in my 30 years of experience, I've never witnessed a moment like this where we're having a projection of a great Africa.
So, the first question in our discussion here, let's circle back to COVID-19 period. Since COVID, Africa's health security has become a major focus to many countries in Africa. From your frontline view, what is the single biggest weakness, the medicine supply chain right now in Africa?
Maybe before I answer that question, let me step back 1 minute and acknowledge that, yes, the COVID pandemic distressed our healthcare system, right? I think, and we have been able, through the way we approach COVID pandemic, understood what has to be fixed so that we don't go through the same type of experience that we went through during the height of the COVID, right? I think for me, maybe before I get there again, another additional point is really also to acknowledge that it looks like our leaders have learned from it. I was in Lusaka, Zambia last week, where the 75th regional WHO Africa conference was taking place. Health security, health sovereignty were one of the key points on the agenda, which is a strong signal that the African leaders, the African countries have understood that we need to do something different. And that thing different, to your question, is to fix the supply chain. To ensure that never again, if a pandemic hits, we don't have what is needed in the country or close enough to the country so that those who need it the most have it as fast as possible. So for me, it's supply chain, yeah.
We talk about the host country in this edition, the fourth edition of the Intra-African Trade Fair, which is Algeria, is showcasing its logistics hub in this mega event, if we can call it like this. How critical are hubs like, this for getting supplies to patients in North, for example, and West Africa very quickly?
Yeah, I think, it's really enjoyable to be in Algeria today and see all the things that Algeria government is doing to make Algeria a great player in Africa, not only in healthcare, but in other areas such as transport, logistics, communication. It's great to see a place like that and to witness this. I believe that with the situation of Mediterranean, Algeria has a key spot. Key spot with his port. I think, and I truly believe that one way to solve the problem of accessibility of product is to get it as close as possible to those who need it. And therefore, having a hub in country like Algeria, who have all the logistic capability to move them from Algiers or any other port in Algeria to other country in the Maghreb or in the ECOWAS area, would be a key advantage. It's definitely a key advantage.
Many African countries, when we talk about medicines, many African countries want to make their own medicines and their own drugs. where should they start to have the biggest immediate impact, and how can companies, for example, like Roche that you're heading in Africa, help in this case?
Yeah, that's the hot topic nowadays, right? Again, referencing again where I spent my whole of last week in Lusaka, Zambia, where leaders of healthcare in Africa came together to think about the future of healthcare in Africa. One of the key points was local manufacturing. And it was interesting to see how the way we think about local manufacturing has evolved from post-COVID to today. I think post-COVID, the solution was, let's just start building manufacturing of medicine and everywhere in Africa so that we cannot experience this anymore. And now, to answer to your question, actually, to manufacture medicine, you cannot do from active ingredient to filling pill in one go. It takes time because the technology we need to build. And therefore, in my point of view, and to answer your question, and by my experience, we have to start by saying, okay, what is it that we can fix in the short to mid-term while we are addressing the broader element of the ecosystem? And to that point for me is what we call fill and finish. What is fill and finish is to make sure that we import the product already ready to use and put it in the usage form, such as tablet, such as vials, and get them into the hand of those who need the most, which are the patient. For me, fill and finish should be the primary focus point at the moment. And beyond fill and finish is to find a way to do pool procurement, because having them fill finish still need to be brought somewhere in a way that it can reach multiple countries at the same time. So that's what I believe pool procurement could be the second step in these local manufacturing steps. Yeah.
So getting medicines approved across Africa is slow. If you agree with me in this, in this point, what is the one practical thing regulators, for example, can do right now to speed things up without affecting or let's say sacrificing safety?
I think maybe I should start by saying what they should stop doing. In my point of view, they should stop reviewing what has already been reviewed, right? Respecting safety and sovereignty. Now, to that point, we have today mechanisms in the world that allow to accelerate access to medicine for patients. And that process is, for example, the regulatory reliance. We today have a regulator who have already assessed some of the medicine that we are using at the highest level of quality, of safety. And therefore, using the reliance framework to not redo what has already been done is, in one hand, hitting the speed in the hand of the patient, but also limiting resource utilization. So for me, reliance is to the reliance to what has already been done by other authority, and authority where good standard is one practical way to ensure that regulatory is not anymore a delayer to medicine in the hand of patient. Yeah.
So long story short, because unfortunately we are running out of time. If the CEO, for example, of an Algerian, let's say, drug company wants to start exporting, product across the region or maybe across Africa, what is the first thing they should pay attention to when they leave here from this, event?
The first thing they should pay attention to, of course, after having a medicine, is to ensure that the other country will accept that medicine. And the acceptance is based on regulatory approval. And that was referenced before, the day that Africa, we have a reliance on what is approved in Algeria can be used in Côte d'Ivoire, that first thing will be easier. And the good news is the African Union has solved for that. The African Union has just created what we call the Africa Medicine Agency, which will be based in Kigali, Rwanda. And the role of that Africa Medical Agency would be actually to harmonize how medicine are approved in Africa, and therefore making it easier for the CEO of the Algerian manufacturer referred to take his product to Burkina Faso.
If we talk about Africa, we need to talk about talents as well. Africa always needs a skilled health workforce, since we're talking about health security here. How do you train, this workforce, and most importantly, how can you keep them into the continent or in the continent?
I think African countries have, I would say, robust education and training system. And we see it. We see it with the number of people trained in Africa and we leave Africa to go and work overseas. We see it with how much, startup are burgeoning in Africa. In my point of view, what needs to change, to your point, is maybe to link education with what is needed the most. Let me give you a good example. In the Northern Europe country, for example, the Minister of Plan, the Minister of Education, and the Minister of Health sit together to see where is it that we need to educate our people. For me, coming together.
Thank you, Mr. Tchoumi, because we are running out of time, as I told you. Thank you for sharing all of your insights with us.
Thank you for having me.
And back to you now, Karim.